Good evening, everyone. I'd like to start by thanking Dr. Hussein Khari and Dr. Khalid for this opportunity. It's a great idea to bridge the gap between the departments. I'm going to be very quick. They want me to give it in 5 minutes. I don't know how, but I'll try my best. I'd like to give you an idea about the faculty in our department, the education we provide, the kind of research we're involved in, and the patient care research. Our mission as the Clinical and Chemical Pathology Department is to provide excellence in laboratory service, teaching, training, and research activities. Over the years, we have accomplished several organizational changes. We have documentation. Where's Dr. Ahmed al-Sharqawi? We do have documentation to all our activities, all our lectures. We have a website, a database in the department. We have an annual progress report that shows all the recent events that happened during the year. We have 3 deputies to the chair. We have a deputy for scientific research, a deputy for teaching and training, and a deputy for the examinations. We have several committees, and this was one of the requests of the Quality Assurance for Education. This is the organizational chart of the department. At the top you will find the chairman, and we have the head of the clinical pathology and the head of the chemical pathology. We have a lab at each of the following hospitals: in the Malian Hospital, at the Japanese Hospital, at Abu Rish Hospital, in the Internal Medicine Hospital, in the French Hospital, in the 4th floor hospital. We have 2 new labs, one in the new ER hospital and one in the new maternity hospital. I would also like to highlight that the blood bank is under our supervision. And just last month, a merge happened between the lab in the oncology and the nuclear medicine and between our labs. Very soon, our staff members will be present in the oncology and nuclear medicine lab. We have a very distinctive organizational chart within each lab. We have a lab director who is responsible for the managerial aspects. We have a technical director who is responsible for the scientific aspects, and we have heads of units. This was very important so that everyone knows what to do and who reports to whom is very clear. We have a total manpower of 1,000, and this includes doctors, technologists, technicians, nurses, admin staff, and cleaners. Out of the 318 doctors, we have around 250 faculty staff, 44 residents, and 24 specialists. We have 3 roles, like all the departments in the hospital and in the faculty. We play 3 roles: education, research, and patient care in the form of laboratory service. In education, we provide undergraduate teaching to the 6th-year students, and only recently, during the summer holidays, we also provided summer training to the undergraduates. Our main bulk is postgraduate training and teaching for both master and doctoral degrees in clinical and chemical pathology. We give tailored degrees in hematology, clinical immunology, clinical microbiology, and clinical chemistry. We are also involved in the teaching other departments in the postgraduate specialties, and the master's, doctorate, and diplomas. And only this year, starting from 2011, the new academic year, we became involved in the Egyptian Fellowship Board training. We have weekly seminars in all of our specialties, and recently we have a yearly tradition of a yearly conference. We hosted 3 very successful conferences under the name of ClinChem, and inshallah this year we are going to have a ClinChem course, which is a collaboration between the University of Toronto and Cairo University. Just last week, in collaboration with the Egyptian Society of Laboratory Medicine, we organized the Egyptian Society of Laboratory Medicine Conference for 2012, and currently their workshops are running in our lab. As regards training workshops, we have a lot of collaboration with other departments. We have a collaboration with the pediatric endocrinology team at the pediatric hospital. We co-organized a very interesting workshop on screening of metabolic disorders. Our infection control team is a very active one as well. They do a lot of work with the number 3 in the USA and Cornell University. As regards research, we have 6 key research subjects, which are hepatitis C, stem cells, neurodegenerative diseases, infection prevention and control, hematological basis of malignancies, and juvenile diabetes mellitus. 2 of our faculty members received the research awards, who are Professor Hiba Abdelrazak. She won 2 awards, actually not just 1. She won the National Egyptian Promotional Awards and the Cairo University Encouragement Award. And Professor Hala Gabr did receive the University Award for the highest impact factor last year. We received funding from the faculty for more than 8 major projects, one of which was just published last month in the Infection and Genetics journal with an impact factor of 3.9. We have 2 STDF grants in stem cell as the theme of the grant, 2 Cairo University grants with also stem cell as the theme of the grant, and we have joint projects with a number of 3 USAID and Cornell University. Just in 2011, our faculty have published over 20 international publications in various journals like Blood Coagulation and Fibrinolysis, Comparative Clinical Pathology, the Journal of Investigative Medicine, Experimental Clinical Transplantation, the Journal of Periodontology, Leukemia Research, Journal of Stem Cell Revision and Reproduction, the European Journal of Immunology, and the highest impact factor was 4.9 with the lowest of 0.3. Just last month, the first edition of the Eastern Mediterranean Acute Respiratory Infection Surveillance Bulletin was published in collaboration with the infection control team in our department. And this is in collaboration with the WHO and the NAMO. As regard patient care, we have an extensive menu of lab tests that are all available online. We have a website, which is www.clinicalcairo.org. You can log online and you can find a list of tests. We provide these tests in all our specialties, which include hematology, clinical immunology, molecular diagnosis, clinical microbiology, and clinical chemistry. Our labs are open from 8 o'clock in the morning to 2 p.m. and from 2 p.m. to the next morning, our service is provided through the emergency labs. Just last year, we provided 4.5 million tests, and this was done across our labs. In Manuel Hospital, French Hospital, Japanese Hospital, and 4 of our 8 labs present in the 8 hospitals that we supervise. This is how the lab used to look in the 1940s, and this is how our hematology lab looks now. Our hematology lab in the main lab in Manuel Hospital received the RICAS accreditation, which is, the RICAS certification, which is an external quality control certification. This is how the immunology lab looks now, with an ELISA and Axiom units. This is the cytogenetics lab, where we do our flow cytometry and karyotyping. This is the molecular diagnostic laboratory, or the PCR. This is the medical microbiology unit. Clinical chemistry, where the trace elements are estimated, where the routine chemistry tests are done, hormones, tumor markers. And this is our website. If you'd like to contact us regarding any partnership, any collaboration as regard research, or if you'd like to know more about our services, please log online and you'll find all the details. Thank you very much.